third and final part of my Amish culture video, beginning with high risk in the Amish culture. Like we discussed earlier with pregnancy, intermarriage is very high in the Amish culture, so there is a very high risk for genetic and hereditary disease. This does not in any shape, form, or fashion deter any family at all from having more children. They believe that children, again, are a gift from God. So when children are affected with these ailments and these diseases, they are treated and are seen usually by English healthcare providers. But again, these genetic diseases that are seen within the Amish culture are usually ones that are only seen within this very specific culture because of intermarriage. Immunizations are one thing that I found to be very, very altering and very varying within the different districts and the very different families within the Amish culture. While some do believe in the use of immunizations, most don't. So there's a very high risk of preventable diseases and epidemics within the Amish culture that are not prevalent or thought about within the English healthcare system, due to the fact that we do receive these immunizations throughout childhood and throughout adulthood. So exposure to these varying diseases that can cause epidemic are very high within the Amish culture and the Amish community. Lack of continuous English and mainstream healthcare really plays a role within the Amish culture. While many individuals do see healthcare providers for various illnesses, there is not a very consistent and continuous healthcare throughout the Amish life. So certain diseases and the prevalence of these diseases is really not known due to the lack of continuity of care and records and studies throughout this culture and throughout this community. Death within the Amish community and the Amish culture is seen as a part of the natural rhythm of life. It is God's will at any age that death should occur. So while mourning does occur, it is more of a review of life and a celebration of life instead of grieving and mourning and anger throughout the community. It is believed that there is life after death, and funeral services like church will be held within a home within the district of the Amish community. The study that I researched for the Amish culture is the use of complementary and alternative medicine versus mainstream healthcare. Since folk care and folk medicine is very, very high within the Amish community, I thought this would be a very, very appropriate study. The study interviewed 134 Amish members along with 154 non-Amish members. They were asked about their use of manipulative body-based practices, which includes chiropractic therapy, massage, as well as reflexology, energy medicine, which includes Reiki therapy, polarity therapy, with acupuncture, mind-body medicine, which includes meditation, yoga, powwow, prayer, and healing therapies, and finally biologically based medicines, which includes herbal and dietary supplements. A description of each one of these therapies was given to each individual that participated in the study, and they gave a yes, no, or don't know answer to the interviewer. Any participant who gave back a don't know answer, that question was thrown out of the study. 95% of the groups, including Amish and non-Amish, had used some kind of complementary and alternative medicine. 99% of those who participated in the healthcare study reported seeing one mainstream healthcare provider at least one time throughout their lifetime. The Amish reported that a chiropractor was the healthcare professional that they saw most often throughout their lifetime, and that the use of manipulative and body-based practices was more used in the Amish more frequently than a mainstream healthcare provider. With this culture and when they are seen in the acute care setting, we really have to make sure that any therapies, procedures, anything is really explained to them on an educational level that they can understand, and as well as the thought to take time and make sure that they are okay with the technology that we are using in the healthcare setting, as well as the use of any immunizations, the use of any testing, the use of any medication. Make sure that it is all fully understood and provided on a level that they understand. Pregnancy is a topic that I saw very, very prevalent in research studies. So making sure that not only the woman and the wife herself understands what's going on. It's very big in the Amish culture that the husband approves and is okay with the therapies and the healthcare that's being provided. So making sure that the father or the male head of household approves of the therapies and the studies that are being used is very very important within the Amish healthcare culture. As far as providing care, there really is not any specific things that I could find that were taboo, that were illegal, that were breaking their moral code within the Amish culture. Just making sure that education is being provided and that the therapies, procedures, and processes are very understood by the individual themselves is one of the main and important factors in providing care for the Amish culture. Thanks for watching my video, and I hope you learned a little something.